Born in the USA. There's only two forms of medicine that are native to America. The eclectic medical profession, which had a short life of 102 years, and naturopathic medicine, which is the doctoral degree that Dr. Brinker, Allstat, and myself received from the National College here in Portland some 30-some years ago. The three of us combined for 100 years of experience, me as a clinician, Dr. Brinker as a researcher, and Ed as a high-quality manufacturer of healthy foods and herbs and extracts that come from nature and retain that vis or that vitality. People don't really know the past of medicine, but when America first declared its independence, we had what was called medical pluralism. Anybody could call themselves a doctor. Anybody could treat anybody. There were no boards, no regulation. And the medical doctors from Europe were continuing what was called the bleed, purge, and puke method of 400 years, where they would use leeches or lancets, where they would use mercury, and where they would use a South American herb to purge the system. And it was a system of medicine that was nothing but dogma. There was very little education. They theorized about what was going to do, and they treated. And they never looked at outcome. They never looked at what they were doing to help people. And then along came the medical reform movement. First called the Medical Reform School, and later the Eclectic Medical Institute in Cincinnati. They actually looked at what happened when you treated people, to see if you helped them. And that developed the first scientific model for over 2,000 years of looking at cause and effect. And when Scudder, who Dr. Brinker talked about, found a precipitate, and he said, gee, I wonder what this does and how it works. They were named eclectics because they would take in what worked and throw out what didn't, instead of having a zealous dogma that said we'll never change. And they would be at the height of American profession today were it not for an economic medical movement that started happening when all of a sudden conventional doctors threw away the leeches to a large degree and coined the term scientific medicine, and began a movement that slowly eroded the various medical pluralism that existed, so that there were only a few camps of medicine and a few choices for people. Hidden and almost dead was the naturopathic movement. The eclectics died, but the naturopathic movement took in the safe empirical evidence of the eclectics, and in the 1940s and 50s began the professionalization that brought you the naturopathic medicine today, and companies like Eclectic Institute that still look for the refined science of extracting the best of plant medicines into products for humans to consume, to help them be healthy, to help make them well, and to improve their quality of life. This is John Uri Lloyd. Lloyd's Pharmaceuticals was part of the stimulus of our pharmacist Ed Allstat in creating this company. And Eclectic Institute brought back his cold diffusion method. Eclectic Institute has been at the forefront of many innovations, continuing to absorb what worked in the past, but to look for new options that can create a better future.